Good afternoon. You're watching Boritzer's Bio-briefings. I'm Dr. Rafi Boritzer, right here on ThinkTech Hawaii Television. Today we have a very special show. It's actually a continuation of our previous segment on islands of health. And today we are devoting the whole show to healthcare in a very special place, actually a model of healthcare for much of the poor world, and that's the island of Cuba. Those of you who may be old enough, like I am, to remember the Cuban Missile Crisis, somehow notice that except for occasional verbal battles via television or international stages or UN, the role of Cuba as a international, perhaps irritant to the United States has diminished greatly, and Cuba has served primarily as a pawn of contention between candidates for electoral office in the United States. But today we're going to talk about a very special point or a special place that Cuba occupies in the world of health and medical care, especially in light of the recent brouhaha that has engulfed the American political stage with the Affordable Care Act, popularly known as Obamacare. And now that Obamacare, or the Affordable Care Act, is pretty much an accepted fact of life and unlikely to radically change for a number of years until we get some reports and feedback and adjustments to the American healthcare system. But most people who are in the field of healthcare recognize that not as much a change as most people had hoped for will take place, because America is still governed by the needs of both the insurance community, the healthcare community, the hospital providers, the medical providers, and the political brouhahas that erupt very frequently in the American legislative systems. So the current debate is largely irrelevant, though, in charting a path for poor countries of Africa, Latin America, Asia, and the Pacific Islands. That is because the U.S. squanders perhaps 10 to 20 times what is needed for a good, affordable medical system. The waste is far more than 30% overhead by private insurance companies. That includes an enormous amount of overtreatment, creation of illnesses, exposure to contagion through over-hospitalization. We all know about iatrogenic disease processes. That means that when you go into a hospital or into an emergency room, you're at a much higher risk of getting sicker than for whatever the original problem that you came in for the treatment. We have creation of illnesses through overexposure, through over-hospitalization, and a lot of this has to do with the lack of a prevention-focused research and model, and making the poor sicker by refusing them treatment. It's hardly encouraging when you go into an emergency room in the United States and find that you have a waiting time of anywhere between 2 to perhaps sometimes as long as 24 hours. If you weren't very sick, you will be getting very sick shortly. Poor countries simply can't afford this kind of healthcare system. Well over 100 countries are looking to Cuba to be an example, which has the same 78-year life expectancy. Now think about this, the same 78-year life expectancy that the U.S. has, while spending 4% per person annually of what the U.S. does. 4% is spent in Cuba to achieve the same end results in terms of healthcare. So the most revolutionary idea of the Cuban system is that doctors live in the neighborhoods in which they serve. So I guess if you're serving Watts in Los Angeles, you're going to be living in Watts instead of Beverly Hills. Doctor-nurse teams are part of the community. They know their patients well because they live near or in the community. The doctor's office in Cuba, known as a consultorio, is where they work. They are backed up by policlinicos, the actual clinics or which provide the services during off hours and offer a wide variety of specialists. They coordinate community health delivery, they link nationally designed health initiatives, and also look after the local implementation. Cubans call their systems MGI, which stands for System of Medicina General Integrale, Comprehensive General Medical System. Its programs focus on preventing people from getting diseases and treating them as rapidly as possible. This has made Cuba extremely effective in terms of control of everyday health issues. Having a doctor's office in every neighborhood has brought the Cuban infant mortality rate below that of the US. Less than half of US Afro-Americans. Cuba has a record unmatched in dealing with economic support in terms of its healthcare system, and also treating chronic infectious diseases, consequently for the very little money. You might be pleased to hear, or you might be surprised to hear more accurately, that Cuba eradicated polio in 1962, malaria in 1967, neonatal tetanus in 1972, diphtheria in 1979, and a whole host of other infectious diseases, congenital diseases, things like measles, rubella, TB, meningitis. And this is all from being a small, resource-deficient island with many, many needs. So I think this thing, remember this MGI, the system of the doctors serving the communities in which they live. And what I'd like you to do now is just take a look at this first description, and what we're going to do today is actually not only give you different views of the same healthcare medical services in Cuba, but we're going to give you different perspectives. We're going to look at four different perspectives of the Cuban healthcare system, looking from the traditional CNN perspective, looking from public television perspective, looking from Russian television perspective, and looking from an academic perspective from one of the established authorities on community and public health at Oxford University. So with that forward, why don't we roll with the first video?
We continue with our series of reports on healthcare systems around the world. Tonight, the state-run healthcare system of communist Cuba. Cuba provides medical care for everyone that lives on the island nation. Life expectancy there is 78 years. But there are some key reasons Cuba's system isn't a model for healthcare in the United States. Brooke Baldwin has our report.
Cuba, an impoverished Caribbean nation facing major shortages in food, drugs, and jobs. Still, the healthcare system in this third world nation is producing some world-class results.
Cuba has the longest life expectancy of any country in Latin America.
And with an average of 78 years, Cuba's life expectancy equals that of the United States. Cuba's healthcare system is socialized, the goal that everyone gets equal and free access to treatment. Cuba is strongly committed to primary care with a doctor and walk-in clinic in every neighborhood. In 1999, the World Health Organization reported there was one doctor for 171 people. But that was before Cuba sent thousands of doctors to Venezuela. In the U.S., the figure is 1 for every 416. One sign of success, according to the WHO, figures in 2005 showed Cuba had the lowest incidence of HIV in all of the Americas.
They were able to build a response on a very strong primary health network that already existed.
In an effort to avoid costly procedures, prevention is key in Cuba.
They concentrate on bringing services closer to people's homes so that the big ticket items don't sponge up all that small budget they have.
Cuba spends 7% of its GDP on health care every year and $363 per person, while the United States spends 16% of its yearly GDP and $7,290 per capita every year. Critics point to abysmal hospital conditions and an acute shortage of modern equipment, and doctors are paid an average of $15 a month. But the biggest challenge, the U.S. trade embargo, which makes it difficult and costly to to buy the best medicines on the market.
But that's less the healthcare system. That's more the broader economy and their ability to buy drugs and medical devices on the open market.
The difficulty in gaining access to certain medicines and treatments in Cuba has led to a growing black market economy, or what they call socialismo, and there are reports of doctors charging patients under the table for better, quicker care, Lisa. And it's interesting looking at all these different countries. We're talking about Russia tomorrow, and it very much so happens today, giving doctors vodka and chocolate, since it's a cultural thing and partially really under the table thing.
Yeah, Brooke, when I think of Cuba and their healthcare system, don't they have foreigners going there actually for medical services?
They do, and I think a lot of people don't realize that necessarily, but there are people who come from Europe, from other parts of Latin America. There's a famous Argentina football soccer player who went to Cuba for treatment because of the specialists that are very popular and very good in Cuba. In fact, it's part of what is funding their system in place.
All right, Brooke Baldwin, thank you very much for that report. Well,
No, you're not watching the NBA playoffs. You're watching Boritzer's Bio-briefings right here on ThinkTech Hawaii television. And today we are presenting a show that will describe in some detail and perhaps a serious evaluation of the quality of Cuban medical health services, especially in comparisons to its next door neighbor in the United States. When we come back, we're going to go in depth and look at the different perspectives on the same system. You're watching Dr. Rafi. Come back, because if you don't, we're watching you.
Hello, I'm Martin Despang, and I'm the host together with the one and only Ali Yamashita, and our show is called Urban Transcendence. And Urban Transcendence is about identifying where we have a unique situation of a vibrant city in one of the most beautiful natural environments. So how these two can coincide, sometimes conflict, how they could find reciprocity in the 21st century is what we're excited about. And we're planning on bringing in a diverse body of guests, both from the arts and the science and the established and the wise and the emerging generation. So hope you will join us. We'll always be on Thursdays from 1 to 2 p.m. Thank you very much.
We're back, and we've been watching you right here, as you've been watching us on the boards of Bio-briefings at ThinkTech Hawaii television. Our topic today is the leading healthcare services model, which is in the Cuban Republic, and we are covering their success in creating a model for some of the poor countries in the world. And first, it's not necessary, according to the Cuban model, to focus on expensive technology as the initial approach to medical care. If you remember, when you come into the typical American emergency room or doctor's office, one of the first things that gets utilized is the EKG machine, the scale, the thermometers, the blood pressure cuff, all the telemetry, all the equipment, all the recordings, everything that could possibly give a clue as your current metabolic state, your circulatory state, every type of physical parameter. Cuban doctors use machines that are available, but they have an amazing ability to treat disaster victims, for instance, in field surgery. They are very aware that most lives are saved through preventive medicine, such as nutrition and hygiene, and that traditional cultures have their own healing wisdom. This is in direct contrast to the Western medicine, especially one that is dominant in the U.S., although this is changing to some degree, we must admit. In the U.S., we use costly diagnostic and treatment techniques, as I previously mentioned, as the first approach, and we're usually contemptuous of natural and alternative approaches. Second, the Cuban model emphasizes that doctors must be a part of the community, and we mentioned this at the opening, especially the community where they're working. This could mean living in the same neighborhood as the consultorio, which means the clinic. It could mean living in a community that is more violent even than some of the areas that are known in downtown Santiago. It could also mean living in emergency tents adjacent to where victims are housed, as Cuban medical brigades did after the 2010 earthquake in Haiti, or staying in a village guest house in Ghana. Cuban-trained doctors know their patients by knowing their patients' communities. In this, they differ very sharply from U.S. doctors who receive zero training in how to assess homes of their patients. Thirdly, the MG model that we mentioned. The relationships between people go beyond the sets of facts. In fact, instead of memorizing mountains of information unlikely to be used in community health, which U.S. students must do to pass medical board exam, Cuban students learn what is necessary to relate to people in the clinics or the neighborhoods, in the field hospitals, in the remote villages. Far from being nuisance courses, studies in how people are biopsychosocial beings are critical for the everyday practice of the Cuban medicine. Can you imagine your typical family physician taking the time out to talk to you for 20, 30 minutes just to get an awareness of your home environment? Perhaps it is influential in what your ailment or symptomatology is. Fourth, the MGI static model is not a static one, but is evolving and unique. Western medicine searches for the correct pill for a given disease. It's a rigid approach, a major reason for researchers to discover a new pill after the side effects, perhaps, of the first pill subside. Since traditional medicine is based, on the culture where it has existed for centuries, the MGI model avoids the futility of seeking to impose a predetermined mindset on other societies. We're going to continue with some of these principles of the Cuban model after we see our next film. Now, this is a broadcast from American Public Television, and I think you'll appreciate perhaps a little more in-depth perspective than the previous CNN's offering. We're going to do two. No, not the Russian, the next one. Yeah.
Next, medical care in Cuba, where many ounces of prevention are considered worth a pound of cure. Here is the second of Ray Suarez's reports.
One of Cuba's greatest prides is its healthcare system. Cuba's government promotes the country's free and universal medical care from the moment a baby is born as the cornerstone of its communist state. And according to the World Health Organization, the country has much to boast about. The average Cuban lives to the age of 78. That's slightly longer than the lifespan of the average American. The cost of health care in Cuba is less than $400 a year per person. In the U.S., the annual tab is almost 20 times higher. And there are twice as many doctors per person in Cuba than in the United States. In fact, it's the highest doctor-patient ratio in the world. How can one of the poorest countries in the Western Hemisphere provide free care and achieve such impressive health outcomes?
Prevention, prevention, and more prevention.
Gail Reed is American-born and living in Cuba. She edits a journal that studies Cuban medicine called Medic.
Having access to family doctors and nurses, I think, has been a key to Cuban success, even when there wasn't much medicine in the medicine cabinet. The preventive approach, having healthcare workers accessible to people, doing home visits is a critical part of the success.
Unlike the rest of the developing world, there's no doctor shortage in Cuba, which means the healthcare system here can push doctors and nurses down to the smallest rural communities, providing a kind of care that's both personal and persistent.
Here in rural Moncada, Dr. Orisloriam Morales spends every afternoon making home visits.
Buenos días. ¿Cómo estamos por aquí?
She reaches about 6 homes a day. After she finished medical school, free of cost for all Cuban doctors, Dr. Morales was assigned to work in Moncada. All new doctors must work where the government assigns them. Like everything in Cuba, the government keeps a close eye on medical employment, ensuring that all Cubans have access to care and that each doctor has no more than 1,100 patients. On this day, Dr. Morales is following up on an 86-year-old patient who suffered a hip fracture. But Morales says her exam doesn't only check the patient. She's on the lookout for other health threats.
The objective is not just to see the sick person in the home, but also to prevent illness. We do a physical exam of everyone in the home and inspect the living conditions.
It's aggressive preventive medicine. Homes are investigated, water quality checked, electrical plugs checked. All the other people in the household also get a checkup. Dr. Jorge Delgado is with the Cuban Ministry of Public Health.
Preventative medicine in Cuba is a premise. There's a saying, it's better to avoid someone falling off a cliff than to pick him up after he's destroyed on the ground. In Cuba, preventative health care is a victory of our revolution.
In such a poor country, however, it's not always easy to treat illness.
When a Cuban patient goes to a hospital, he must rely on the resources available at that moment. Sometimes, a simple urinary infection can't be treated because they don't have the right antibiotics or some of the basic medications that treat chronic illnesses.
Julio Alfonso is a doctor who fled Cuba in the early 90s when the country was in severe economic crisis. Alfonso became frustrated with the limited financial resources given to Cuban doctors. His Miami organization, Solidaridad Sin Fronteras, Solidarity Without Borders, gives scholarships to nurses and doctors who defect from Cuba and want to retrain and get board certified in the U.S.
Cuba looks abroad to supply the Cuban people. Every Cuban has a family member abroad to send medicines. Plus, there are organizations like ours that send medical supplies.
But Gail Reed says one of the biggest problems remains the embargo of medicine from U.S. pharmaceutical companies.
There are serious restrictions on patented medicines. The latest cancer drugs, for example, have patents that are 20 years, and now the pharmaceutical companies are asking for more time for their patents. So these are unaccessible to Cuba in regular commercial terms.
Because of the U.S. government's trade embargo, Cuba has created its own biotech industry. Some of its strongest successes have come in preventive medicine, like vaccines, including one for hepatitis B, now virtually eliminated from the country. Manuel Raíces Castañeda is an executive for Cuba's Center for Genetic Engineering and Biotechnology.
En el sentido de que nos creó una gran necesidad.
In the sense that it created a great need, yes. It created great suffering, but at the same time, the embargo created the challenge of trying to resolve our own problems. And we developed an industry capable of producing the very latest medicines.
According to Raíces, the Cuban biotech sector has garnered 230 international patents and is marketing its products in 57 countries. It's now the third largest industry in Cuba. Still, some ask if living to the age of 78 is worth it, if it means living in persistent economic hardship. Carlos Castañeda, a Cuban-trained physician who left the island in 1995, says there's more to living than staying healthy. After arriving in the United States, he took odd jobs for 16 years and is now in the process of getting his physician's assistant's license.
I had to do anything. I had to work in the beach as a bellman, logging, carrying luggage to everything. I was valet parking. I did it, you name it. I did everything, but I was happy because I was working and I was making money, and I always thought that I had a light at the end of the tunnel.
But in Cuba, the rewards for doctors are often talked about in philosophical, not financial terms. Free medical care is considered a basic right. Preventing illness is considered a state priority. And doctors who provide those services are considered foot soldiers in Cuba's social revolution.
La educación en Cuba, como se conoce, es gratuita.
Education here in Cuba is free, so providing good medical staff for Cubans is practically a duty, but it is also considered an honor.
In an era when countries are struggling to do more for less with limited healthcare dollars, Cuba's successes in prevention are likely to be closely watched.
Tomorrow, Ray and the Global Health Unit will report on one of Cuba's choice exports, doctors.
Welcome back. You're watching Boritzer's Bio-briefings. Our special show today is on the Cuban healthcare system, which has become a model for most of the world's poor countries. And so we're going to continue right after our break.
I'm Hong Jiang, host for Asia in Review on Tuesdays.
And I'm David Day, host for Asian Review on Thursdays. Both of us broadcast our respective shows at 4 p.m.
And my topics tend to deal with questions related to environment, culture, history, and sometimes human rights.
And my shows tend to be on international business, foreign policy, geopolitics, and national security. And you can watch our shows live on the ThinkTech website at thinktechhawaii.com.
And you can also watch us on YouTube or Olalo.
So come join us on Thursdays at 4 p.m. I'm David Day.
And on Tuesdays at 4 p.m., I'm Hong Jiang.
Aloha.
Aloha.
As promised, we came back. We won't disappoint you. We've been talking about the Cuban medical system, and I should mention, because of the very aggressive ideological, perhaps propaganda or education of poor countries that Cuba has tried to engage in to extend its the realm of its socialist brotherhood, so to speak. It has used also healthcare and medical care as an outreach, as perhaps a foreign aid form that in lieu of what the Western or the big powers or countries such as China and Russia, when they give foreign aids, they usually come with material goods, with jet planes carrying specialists or carrying equipment and so on. The Cubans have tried to use a very unique model, basically sending teams of their Cuban-trained physicians, technical personnel, nurses, and methodology, which doesn't require a lot of equipment. They've used this as a form of foreign aid, as perhaps ideological credentials to prove that the socialist model of Cuban political life is the one that is most helpful to countries trying to emerge from poverty or perhaps deal with the capitalist ethos of the rest of the economic structure of the globe. So let's look at some of these other principles that make up this, so to speak, articles of faith in the Cuban medical service. And one is when they offer medical care to other countries, whether it's in South America, Southeast Asia, or Africa, they adapt the medical aid to the political climate of the host country. This means that whatever resources the host government is able and willing to offer, and living with its restrictions. Those hosting a Cuban medical brigade may be friendly, as in Venezuela or Ghana, or they could be hostile, as the Brazilian Medical Association was, become increasingly hostile, as occurred after a coup in 2009 in Honduras. Or they can change from hostile to friendly, as occurred in Peru with the 2011 election of Ollanta Humala. This is quite different from U.S. medical care, which, like food aid, is part of the overall effort to dominate the receiving country and perhaps push it into adopting a Western model. Another principle of the Cuban methodology is that the MGI model creates the basis for dramatic health effects. Preventive community health, community training, a desire to understand traditional healers, the ability to quickly respond to emergencies, and appreciation of political limitations give Cuban medical teams astounding success. During the first 18 months of Cuba's work in Honduras, following Hurricane Mitch, the infant mortality dropped from 80.3 to 30.9 per 1,000 live births. When Cuban health professionals arrived in Gambia, the malaria decreased from 600,000 cases in 2002 to 200,000 cases just 2 years later. So you can see the proof of the eating, or the proof of the pudding, to say more correctly, is in the eating. And they've had successes. We're going to see another film now. Now this is with a very socialist slant, I should say, even though the Soviet Union, or perhaps more correctly Russia, no longer ascribes to a socialist philosophy. So let's look at the Russian television description of Cuban health services outreach.
those who think the United States has the best darn healthcare system in the world, I have a little mission for you. Go to Florida, go down to the very southern tip of the state, and look to the south about 90 miles off the coast. There, if you could, you'd see Cuba. And trust me, looking at Cuba won't cause your eyes to burn out of your sockets, it won't turn you into a pillar of salt, and it won't get you dragged in front of the House Un-American Activities Committee. Instead, you'll actually learn a lot about what a compassionate and effective healthcare system is supposed to look like. Even though Cuba is one of the poorer nations in the world, with an economy that ranks 89th and a GDP of just $57 billion, compared to the U.S. GDP of $14.5 trillion, Cuba still performs just as well in life expectancy and infant mortality as the United States. So how is that? How is a poor, economically disadvantaged nation matching and in some cases beating the mighty United States? It's because since the revolution in 1959, Cuba has made health care its #1 priority, giving every citizen free access to basic health care, all paid for by the government. And it's worked. Cuba has 535,000 healthcare workers, and its biggest export to the rest of the world is doctors. And when looking at disease epidemics like AIDS, for example, Cuba is doing much better than the United States at treating its citizens. The counter-argument here is that Cuba is a small nation while the United States is a big nation, so it's much easier to give health care to smaller populations than larger ones. So rather than comparing Cuba to the United States, let's compare Cuba to New York City, which has roughly the same population. In the last 3 decades, 78,763 New Yorkers have died of AIDS. In that same time, though, only 2,364 Cubans have died of AIDS. So what the heck is going on here? Well, the New York Times has figured it out. In a recent article on this issue, the Times writes, other elements have contributed to Cuba's success. It has free universal basic health care. It has stunningly high rates of HIV testing. It saturates its population with free condoms, concentrating on high-risk groups like prostitutes. It gives its teenagers graphic safe sex education. It rigorously traces the sexual contacts of each person who tests positive. Each Cuban citizen has a doctor they can see for free. And if they miss a routine checkup, then that doctor is supposed to track down their patient and find out why. Compare that to the United States, where you're lucky to get an appointment with a doctor within a few months. And even if you do, you have to pay an arm and a leg for the visit. Also, pregnant women in Cuba get 12 free prenatal checkups and are tested for HIV at least twice before giving birth. And children are given comprehensive sex education. Somewhere, Rick Santorum's head just exploded. The New York Times goes on to compare how the United States deals with our AIDS epidemic, writing, by contrast, the response in the United States, which records 50,000 new infections every year, seems feeble. Millions of poor people never see a doctor. Testing is voluntary, and many patients don't return for their results. Sex education is so politicized that many schools teach nothing about protected sex. Condoms are expensive, and distribution of free ones is haphazard. Looking at just at how we administer health care, it's hard to figure which nation is the developed one and which one isn't, the USA or Cuba. I think it all comes down to this. We as a nation really have no clue about what really matters when it comes to protecting our population. President George W. Bush was running around warning about bio-terror, you know, the biological, and how we had to take out Saddam before he dumped germs in New York City. And yet we don't even have a healthcare infrastructure in America to deal with a legitimate bioterror attack. Aside from terrorism, we don't have a national healthcare system that can deal with a far more common and normal disease epidemic like SARS or bird flu. Cuba does, but we don't. So while we continue to throw trillions into our so-called war on terror and inflate our monstrous military budget and are all but having to have bend over at the airport, we're still ignoring the biggest threat to the well-being of this nation, and that's our inadequate healthcare system. Cubans get doctors, we get cheered off porno x-ray scanners. So who's safer? Cuba has been embargoed by the United States for more than 50 years now. And while certain aspects of Cuban society have leaked through into the American way of life, like their cigars, the most important Cuban contribution to the world, its healthcare system, is still shunned here in the States. It's time to stop the insanity and make basic healthcare a human right for all Americans. Not just because it's the morally right thing to do, but because our national security depends on it.
No, this is not Russia, but we are watching you. So right after the break, you stay right here, and we'll get back at you.
I'm Jay Fidel. That's Sharon Moriwaki of the Hawaii Energy Policy Forum. And every Wednesday we have Hawaii, the State of Clean Energy. We've been doing it for some time now, and we have some fantastic guests on there, unbelievable guests who give us insight into what is going on in a very complex, sometimes very confusing, sometimes very disappointing area of progress in the state. So we love doing this. We love meeting them. We love talking to them. We love having their ideas out on the table. So maybe, just maybe, we can all make some sense of what's going on. Sharon, what do you think?
I think that's absolutely correct. We enjoy ourselves meeting with all these people and hearing about the energy and the state of clean energy, and hopefully we advance clean energy for the state. So it's terrific. Join us.
Okay, it's every Wednesday. Okay, Wednesday is Energy Day. Every Wednesday, 4 to 5 p.m. Hawaii, the State of Clean Energy, here on ThinkTech Hawaii. We'll see you there. I'm Jay Fidel.
Welcome once again. We are back at Boritzer's Bio-briefings, our special show on the Cuban medical system. And I should mention, actually, there are two issues with using medical and healthcare as a foreign policy and having it work effectively, consistently. One has to do with the volunteerism, which is a very strong part of Cuban society. But of course, the world has changed considerably since the Cuban Revolution in 1959, and the success or the longevity of volunteerism is something that is questionable for the long term. The other issue is one of perhaps the low pay that physicians and medical personnel in Cuba get, and often they supplement their wages by working at second jobs. So how long this will remain in force remains to be seen. We finally will see our final interview. This one is with Professor Bauman of Oxford University, and pay attention.
They are doing all of the things that we said you ought to do in a healthcare system. The only difference is that they are actually doing it. So that the healthcare system in Cuba from the beginning emphasized prevention, early detection, and early intervention to reduce the upstream costs of healthcare. It was made universal, accessible, and available to people free at the point of contact. So essentially, you have a free, universal healthcare system for everybody. Now, it hasn't been easy. There have been many problems along the way, but 50 years later, it has become a model for developing countries all over the world. And not just because of the quality of healthcare, but it is far more suitable for resource-scarce countries than the healthcare systems of affluent, industrialized countries. The first thing that they have done is to put the major emphasis on primary healthcare, so that they have the highest ratio of doctors to population of any country in the world. And they set out from the beginning to train enough health personnel to meet the real health needs of the people. So today there are about 36,000 physicians in Cuba for a population of 11 million. That is one physician for every 378 families. And the distribution of physicians is evenly distributed around the country, so that even in the most distant rural areas, you will have a physician to take care of the population. There are also specialists to back up the family doctors out in the rural areas. And because it's a unitary system, they are able to match the things like medical education and the training of personnel to meet the needs of the healthcare system, rather than it being a random distribution, as it is, for instance, in the US, where you may have vastly too many neurosurgeons trained just because people want to go into neurosurgery to make a lot of money. So you have far too many specialists in one area and not enough in the other, because we don't have a planned healthcare system, we have a random healthcare system. Yes, I mean, so it isn't a sort of cookie cutter situation where you can just transport the Cuban system somewhere else. But you can take portions of it and transport it elsewhere. We have a project that we've been working on for the last 5 years where we have taken healthcare providers and local community workers from 3 high risk areas of the US, West Oakland, South Central Los Angeles, and an area near Albuquerque, New Mexico. And we've taken teams from those communities to Cuba. They've learned about the Cuban healthcare system after being there for a week, and then they've come back and tried to apply those lessons, particularly the lessons of early detection and prevention, to the communities where they live. And that's been very effective. The same way the Cuban system has been picked up on by many developing countries around the world, not as necessarily a direct adoption of what Cuba has done, but taking the pieces that they felt were relevant. Today there are about 16,000 Cuban physicians working in 66 countries around the world, and they bring and train the local people in the lessons of the Cuban healthcare system, and also help to provide healthcare themselves. They pay nothing for their medical training or any of the health-related training. There are a total of 25 medical schools in Cuba. In order to keep the health system decentralized, there are at least 2 medical schools in each of Cuba's 19 provinces. And if you want to go to medical school, you have to go to a medical school in your own province. And this really encourages people to want to stay where in the province where they grew up, the province where they had their medical education, to practice. This prevents everybody flocking to Havana and having, as has been the problem prior to the revolution, of virtually all of the doctors in the country being located in the capital and nobody else having access to physicians. They aren't required to, but every inducement is there to make them want to do it. They have tried to decentralize everything, including specialty training, so that if you want to become a neurosurgeon, you have as much chance of becoming a neurosurgeon in Oriente province as you do in Havana. And so a physician can still rise to a very high level of specialty training by staying where they grew up and where they had their medical training. Yes, this is one of the real problems, particularly in the US, and it comes back to the cost of medical education. It costs a medical student roughly $50,000 a year to get a medical education. So we are talking about in excess of $200,000 by the time you graduate. Most students can't afford that, so they take out student loans. Most medical students, the day they graduate, have a debt in excess of $150,000. I have encountered so many young medical students who, when they started in medical school, were totally committed to working in an underserved area and making that their career. By the time they graduated and had a gigantic debt, they decided the only way they were going to ever pay it off was to go into a specialty that was going to pay them extremely well, even if that wasn't their real inclination, or if they still would have preferred to go into a rural part of the country. So yes, it distorts the whole system, and I think it would be very beneficial to the US to have a far greater subsidization of medical education, and that would largely solve the maldistribution issue. No, I think there are a lot of lessons, and many of them have been learned. One of them is to really emphasize primary health care. Some years ago, we took senior medical students from virtually every medical school in the US. Those who wanted to go could go to Cuba for 6 weeks on electives to work with family doctors in Cuba. And they came back with a quite transformed view of what they felt needed to be done to provide good health care in the US. And that's had a big effect on the teaching in medical schools in the US, particularly shifting the focus away from a preoccupation with training doctors for specialty care and medical research to seeing being a family doctor as a highly desirable way to make a living in medicine. The Cuban government runs a Latin American medical school where they take students from all over this hemisphere, including giving 500 full scholarships to US students. And there are currently over 100 US students in medical school in Cuba. It's a 6-year program, and they have to be fluent in Spanish before they start, even if it involves an extra year in Cuba. Part of the commitment they have to make is to go back to the community, the underserved community in the US that they came from. And there are roughly 30 that have graduated, who've passed the US licensing exams, and are now practicing in places like West Oakland and South Central Los Angeles and other underserved areas in the States. So yes, I think it is possible to make changes, but it requires a serious, conscious effort to do it. And the Cuban system, aspects of it have been copied by countries all over Latin America and to a lesser extent in Africa.
One last question.
I just think that we need to be less parochial and far more willing to look and learn from the success of other countries, not just from Cuba. The World Health Organization rates the US medical system as 37th in the world. Given the affluence of the United States, there's really no reason why 36 countries should have better healthcare systems than the US.
Although Cuba is a small country, the Cuban model has been remaking medicine around the globe, although best known for its successes primarily in Latin America, Africa, and the Caribbean. It's also provided assistance in Asia and the Pacific Islands. It provided assistance in the 1986 Chernobyl meltdown in Ukraine, and in Sri Lanka following the 2004 tsunami, and in Pakistan after the 2005 earthquakes. Many countries hosting Cuban medical brigades are eager for them to help redesign their own healthcare systems. The Cuban healthcare system isn't for everyone, But we wanted to bring you today a picture of what is possible besides just the importation of pharmaceutical manufacturing techniques to countries that cannot afford them, or perhaps expensive electronic diagnostics for people whose salaries cannot be supported by the economy in which they live. You've been watching Boritzer's Bio-briefings. You've been watching our special show on the Cuban healthcare system. Most happy to have you here. We hope you'll join us again. We look forward to it. Dr. Rafi, your host. Until next time, aloha.